Again, the symptoms of hemorrhoids depend on whether they're internal or external problems. If they're internal hemorrhoid disease, internal hemorrhoids typically will present either with bleeding with bowel movements or prolapse, where part of the hemorrhoidal tissue comes out of the anus and then goes back in, either by itself or with pushing it back inside. They're usually painless at that point. External hemorrhoids, people know. They know because it's painful and there's swelling and they can feel it. And external hemorrhoids are outside the anus and belong outside the anus. But when they become thrombosed, it's usually a self-limited process that lasts for about 5 days. And depending on when the patient comes to see us, we sometimes can remove the clot and help them feel better in the short term. Internal hemorrhoids typically are treated with a variety of office procedures. Rarely do patients need surgery for hemorrhoids. I think it's important to see your physician if you have any bleeding from your anus. While most commonly that bleeding is related to hemorrhoids, there are other more ominous things that can cause bleeding, including polyps or cancers. So if the bleeding in the stool is excessive, if the bleeding is intermittent, or if the bleeding is persistent, or if there's severe pain, or if there's swelling, I think it's reasonable to come see your physician, because there are things we can do to alleviate the pain and shorten the duration of your symptoms.